Hey there, it's Dr. Justin Marchegiani. Today's video is going to be on birth control pills and their side effects. We're going to break down their mechanism, how they work, and the potential side effects, and just things that you can do naturally to get to the root cause. So number one, the conventional alternative if you're trying to prevent pregnancy is typically the chemical modality or the chemical pharmaceutical option, which is a birth control pill. There's a couple different kinds that are out there. You have the shots. You have the ones where they insert little things under your skin, little pellets under your skin, and then you also have the typical birth control pill that you swallow. Right? You also have IUDs too that are more physical, deflectant to birth control pill, but you have the Mirena, which is a synthetic progesterone IUD that goes through and prevents pregnancy. But outside of that, you have your birth control pill. And you typically have your synthetic estrogens, like your ethinyl estradiol, like the Yaz, for instance. And then you have your combinations, you have your combinations like Yaz, which is an ethinyl estradiol, and the dosperenone. And then you have your regular estrogen-based birth control pills, which are the ethinyl estradiol, like the NuvaRing, etc. So the most prescribed medications out there are going to be your birth control pills, typically the combo or the estrogen only. And sometimes you'll even see synthetic progesterone ones that are done if you have side effects with the combo progesterone and estrogen versions. So outside of that, right, if you have those issues, if you're trying to prevent pregnancy, that's the typical avenue. Now, birth control pills are also prescribed for other side effects like acne or mood issues like in your period, migraine headaches, excessive menstruation, and a lot of those issues are driven by other physiological imbalances. So if you have breast tenderness or PMS symptoms like you're moody, back pain, breast tenderness, headaches, typically that's going to be caused by fluctuations in estrogen and progesterone, especially in the last half of your cycle, typically about 1 to 2 weeks before you menstruate. We start to see imbalances in that. And I'll draw it out for everyone so it makes sense. But overall, birth control pill physiology 101, take a birth control pill. Let's do the Yaz for this instance here, right? Synthetic estrogen and progesterone. Well, here's your cervix down here. Your cervix is right here. Here's the vaginal area here. And then here's your uterus up here. Just so you can have an idea where you're looking at here. So this is your vaginal area. Obviously, what's going to happen, you take a birth control pill, a few things are going to happen. Number one, it's going to decrease FSH and LH. Those are your pituitary hormones that talk to the ovaries to make progesterone and estrogen. So the first thing that starts to happen is we have decreased FSH and we have decreased LH. Now, why is that? Well, when you're taking a birth control pill, essentially you're telling your brain that you're pregnant. That's why these hormones start to drop. And when these hormones drop, they stop talking to the ovaries to make estrogen and progesterone. So typically FSH is going to then talk to the egg here and stop that egg from growing if it's low. It's going to stimulate the egg to grow if it's high. So if the FSH is low, that egg's not going to grow. So the egg here won't grow. And then with the FSH being low and the LH being low, what tends to happen is you get a thickening of the cervical cap, so it's harder for sperm to make their way into the uterine lining. And typically with a birth control pill, or with natural cycle, estrogen starts to come up in the first half of the cycle, and that starts to thicken the uterine lining. But when you're taking like a Yaz pill, for instance, that has the synthetic progesterones, the dosperenone, that actually thins out the uterine lining. It thins it out and makes it thinner, so it makes it harder for an egg, if it is released, to actually stick into the uterine lining. It makes it harder to stick. So three mechanisms how the birth control pill works. Number one, it's inhibiting ovulation by decreasing FSH and LH. That's the first linchpin, right? If mechanism 2 and 3 doesn't work and that works, we're fine. But let's say an egg, for some reason, does slip out. Let's say the FSH and the LH wasn't quite low enough. Well, then maybe the egg pops out, but maybe it's still harder for the sperm to get in, so maybe number 2 prevents pregnancy from happening. And then maybe number 3, let's say the sperm does make its way in past number 2, and that's number 2 fails, maybe the egg can actually still bind into the uterine lining, but if it's thinner, it's going to be much harder for it to bind in. So kind of recapping here, birth control pill works a couple different ways. Number 1, inhibiting ovulation. Number 2, preventing sperm from getting into the vaginal area to begin with, into the uterus area to begin with. And then number 3, preventing the sperm and the egg from sticking into the uterine lining and fertilizing. All right, so that's the general physiology. So now here's your cycle, just for instance here. So we typically have the first half of the cycle is predominated by estrogen. So estrogen's up like this in the first half of the cycle. And then we have progesterone that predominates the second half of the cycle. And you can see what happens is progesterone rises and falls, and estrogen rises and falls right at the end of the cycle. And this triggers menses, okay? And then we have the part here in the middle of the cycle where ovulation happens, right here and here. And that's where a pregnancy can occur. So basically what's happening with the birth control pill is these hormones aren't going to fluctuate because the LH and the FSH is dropped. Because the LH and the FSH is dropped, we're not going to have that nice natural rhythm of hormone because essentially our brains think we're pregnant. That's the general gist there. So in general, what the birth control pill is doing, instead of imagine there being drops in progesterone here, let's say there are little ebbs and flows of our hormones in the last half of the cycle. If that's dropping or rising in the last half of the cycle, basically what we're doing is getting a high amount of progesterone and estrogen above where we're at. So we're kind of creating a flat line. So instead of having those perturbations, now it's flat and smooth. And then typically around day 21, 22, we take those 5 to 7 days of reminder pills, which then allows the hormones to drop like so. And that allows menstruation to happen if you're on the pill. Progesterone pill, that may not happen if you're on a progesterone only pill, but on a estrogen or a estrogen progesterone combo, that's what's going to happen. So that gives you the general physiological mechanism of how all this stuff's working. Now again, we have side effects. With the birth control pill, we may have more depression. It may affect your mood. It's one of the most common side effects of the birth control pill. Because you're affecting hormones, hormones are intimately connected to our moods. So if you're taking hormones and bringing them above a physiological, or bringing them to a super physiological level, it may affect our moods. Again, candida and fungal overgrowth. Because the birth control pills affect the pH in the vaginal tract, it makes it a little bit more alkaline. So it actually raises that pH a little bit. When the pH is more alkaline, above 7, that makes it more inhabitable for yeast and bacteria to grow. So when you're stressed and when you're on birth control pills, increased chance of a UTI or a fungal infection. And then guess what happens? You're given antibiotics, and then what happens again? You're at an increased chance for a rebound overgrowth. So you can see how one thing kind of increases your chance of intervention that drives other symptoms down the road. Nutritional deficiencies. Birth control pills are notorious for creating B vitamin deficiencies. Folate, B9, B12, B1, thiamine, riboflavin, niacin, all these important B vitamins, vitamin C, vitamin E, zinc, magnesium, selenium, really important for your thyroid as well. So you can see these nutrients are going to be depleted with the birth control pill. So you have to be mindful that if you're going to use it, because that's what's going to be your method of birth control, you have to make sure you're taking high quality multivitamin that's going to replete some of these missing nutrients, as well as a healthy diet on top of that. Decreased libido. Because your birth control pill is increasing sex hormone binding globulin, that's going to bind up testosterone. So if here's your testosterone compound like this, what it's going to do is it's going to bind a protein to it. So here's the protein. It's called sex hormone binding globulin, and that makes it harder for that testosterone to bind into the receptor site. Here's the receptor site over here, and because the purple guy is attached to it, it won't quite fit. So that protein there renders your testosterone or your sex hormones to be a little bit lower functionally. So guess what happens? Libido goes downhill. And also because the testosterone drops a little bit, guess what happens to women's skin on the birth control pill? Tends to get a little better. That's why the birth control pill is prescribed off-label for mood. It can be prescribed for mood in the cycle because it at least levels out the hormone, so it may make it more level. A lot of women report more mood issues. Skin, to help skin, and then also to help with excessive menstruation because it calms down the perturbations in progesterone right here in the last half of the cycle. And then weight gain. This is kind of a controversial one. A lot of places say birth control does not affect weight gain at all, but if you look at the side effects on the bottle or on the drug, it's gonna say weight gain. Now, some of the mechanisms of that are estrogen, synthetic estrogen, this has been studied, increases insulin resistance. So it causes the insulin your body to have to make more of it because the cells are getting numb to the insulin, right? You go ding dong ditch your neighbor, after a couple times they stop opening the door, maybe after one time if they're smart. So that's kind of what happens with insulin. Your body starts making some of it and it's saying, oh, false alarm, and it stops bringing the blood sugar in. So then you need more insulin, which causes the fat cells to grow. Insulin's a storage hormone and causes fat cells to grow. Also, sex hormone binding globulin and thyroglobulin are increased. So thyroglobulin is another hormone where in my analogy over here with testosterone, well, now let's do it again. This is gonna be, let's say this is gonna be thyroid hormone. So I had a T for testosterone, we have TH for thyroid, and then we have the P over here. This is the protein, this is the thyroid binding globulin, which is a protein compound, and that's gonna make it hard for that thyroid hormone to bind into the receptor site over here. So it makes the free fraction, the bioavailable thyroid hormone to actually decrease. So we actually have less thyroid from a functional standpoint. So recap, depression, mood issues by affecting hormones, candida by raising that pH, nutrient deficiencies, this is known, you can go Google this, I'll put some studies in the reference section below, decreased libido by affecting testosterone levels, and then weight gain by affecting insulin, and also by affecting thyroid levels. Last but not least, number 3, fix the root cause. If you're taking a birth control pill because you're trying to prevent pregnancy, fine. I get that, totally makes sense. Take a look at the natural birth control pill video. If you want to avoid the synthetic hormones and some of the potential side effects, I recommend using that. Again, we don't want any unwanted pregnancy, so if that's your only option that you're willing to do or that you can be compliant with, fine, I get it. It's there for you, make your choice. I just want you to be informed so you know the potential side effects, and you also know the other natural options by watching my other natural birth control pill video option, which I'll put on screen so you can access. And if you're having these other symptoms like depression or mood issues or excessive bleeding, or you're having weight gain or skin issues, let's say it's an off-label prescription for the birth control pill, well, you really want to get to the root cause with functional medicine, with getting the adrenals, getting your hormones, and getting your cycle looked at and balanced out. And also, one last thing I didn't mention, side effects. Birth control pills may increase cervical cancer 300%, 3 times, and increase breast cancer 2 times. This is a new study that came out in August of this year. Previous studies have said it decreases cervical cancer and ovarian cancer, but increases breast cancer. Now some other studies are showing the opposite. We're saying, yes, breast cancer is 2 times higher, but now we're saying cervical cancer may even be 3 times higher. And that's from that's an Iranian study. I'll put the PubMed links below and you can take a look at it. So again, that's probably the most important side effect that I almost forgot to say, but that's there for you. So again, if you're trying to get your hormones balanced or trying to get yourself back on track hormonally from some of the side effects of being on a birth control pill or trying to avoid it, click on screen, subscribe. You can always schedule a consult with myself. Again, we have more videos coming your way. Hope you enjoyed it. Have a great weekend. Thanks. Bye.